Hi, my name's Dr Natalie Wright and I'm a Senior Lecturer in Interior Architecture in the School of Architecture and Built Environment, Faculty of Engineering at QUT. As part of the HEAL project, I've been involved in leading the PICU Partnership Project and the CEQ Fellows training, design thinking training workshops, as well as facilitating the design thinking workshop at the HEAL Symposium. Over the last 12 years, I've been working with educators from primary up to tertiary levels, looking at the value of integrating design thinking into pedagogy and curriculum. And so I've been really excited to work with clinicians, health professionals, and the CEQ fellows as part of HEAL to see the innovation that can come from integrating design thinking into healthcare. In this module, I'm going to be talking about the first phase of the design process, Empathise. So I'll just share my screen now. And just taking your mind back to Module 1, you would have been introduced to the D-School design process. And you can see there that Empathise is the first phase of that process. So in this module, I'm going to be talking about some of the tools or the skills that you might develop to in order to empathise better with your patients, the families that you deal with, and other staff and potentially your peers during your clinical improvement projects. So I'd like to talk about interviews, story share and capture, shadowing, personas. Also important to talk about extreme users and some of the mapping tools that are available to you in order to capture some of this information really quickly and clearly. So why does empathy matter? Well, the best solutions come from the insights into the emotions that drive user behaviour. And often we can't really capture these just from our own experience. So it's really important to put yourself in other users' shoes and think from their perspective. So the D-School talks about the Empathise phase as involving observing, engaging and immersing ourselves in the experience. Great way that you can start this process is to have a look at the video that I've highlighted below, A Lesson in Empathy, which was made by IDEO, and it really highlights some of the people that might be involved in some of your projects that you will need to empathise with. Important also to take your mind back to the double diamond, which you would have been introduced to in Module 1. The Empathise phase is that first phase. So it really involves that divergent thinking, which is that creative mindset, right brain thinking. So traditionally that thinking that's used by artists and designers, really opening yourself up to different perspectives and increasing the, I guess, the innovation of the idea by giving yourself the most information to make some crucial decisions about the problem. And also important to emphasize that empathise is not just, the process is not linear. So you may be empathizing at different phases of the design process. Obviously at the beginning so that you can define your problem, but you may have to go back to that phase if, for example, you come up with a solution and test it with a user and it doesn't really hit the mark. So then you need to go back and really interrogate that empathy phase. Some of the tools in your toolkit during this phase will be a good understanding of the design thinking process, using the correct language with your users when you're interacting with them. Teamwork, really understanding your team and the dynamics and values that are associated with the different members of your team. And then the tools like interviewing and storytelling, that deep research that is going to give you insight into those problems that are potentially haven't been yet realised. This poem, The Blind Man and the Elephant, is a good one in helping us understand that if we're trying to gauge a shared understanding of the problem, sometimes we think we know what's going on, but different people only hold a part of that information. So it's important to really engage everyone in the process and recognise that not everyone's an expert. So this means assuming a beginner's mindset, which means that you really need to be truly curious, really talk to a lot of people, really listen to them, and then find the patterns that are emerging once you've spoken to, a lot of people about this problem. Empathise is really a phase that also involves you empathising with your team. So when you're building a team, it's important to recognise that the diversity in your team will give you the best shot at coming up with innovative solutions. So you need people that are left brain thinkers. So the thinkers, the analytical thinkers, and the organisers. Nothing's going to happen if there's no one in the team to organise and plan and implement. And then you need the right brain thinkers. So they're the innovators, the creative thinkers, and then the humanitarians who have great skills at really talking to people, communicating to people. And in design thinking, we often talk about T-shaped people as the best people to have in your team. This means that they have depth of expertise in one area of the problem, perhaps, but they also have breadth of knowledge and an open mind to really, I guess, embrace other cultures, other personalities. They have interests, they have dreams. They're quite open to innovation. So before you start your project and start empathising with your users, it's really important to build your team and to discover the values that everyone holds in your team, not just their skills, but their values. So in the HEAL Symposium workshop, we did an exercise which is about sharing vision. So it's important to then come together as a team to really understand that everyone's on the same page. So in the HEAL Symposium Design Thinking workshop, I asked people to recall a time that they were really proud, engaged and excited about their work and share this visually. So visualization is a huge part of design thinking. It allows us to share ideas really quickly, to share emotions, to have really powerful images that really engage people in the process. So I asked everyone to record that headline of the idea that you wanted to make happen in the next 30 years. So really succinct kind of idea. And we were able to capture a number of ideas that then was a talking point for people in teams to come together to discuss ideas and then come up with a shared vision, again, communicated visually, on a project that they wanted to make happen by 2050. So we were then able to get people to produce this and display it in a gallery walk, which allowed people to comment on the ideas, to contact the people that were interested in that idea, and therefore gather teams around these shared visions. Really important when you're starting a design thinking project is to understand all the people that need to be involved in the project, and those that you might need to engage with during the project. So a stakeholder map's really useful for that. This is an example from the Design Thinking Toolbox. And you can really start to think about the breadth of who's involved, including administrators, potentially government in your case, right down to the patients and families. D-School at Stanford University talks about observation as being a process of investigating what, how, and why. So when you're observing, which is something that I would do as an interior designer, the first thing I would do is visit the site and observe people in, and what they do in that site. So looking at the what, the concrete kind of observations of what is happening, understanding the activities that are happening in that space, and using adjectives to describe that, and then interpreting that information into the motivation and emotions that people feel while they're doing those activities, and revealing some of the assumptions that you might have about what you're seeing. Another tool that's handy is the occupancy survey. So particularly in environmental design projects where you're looking at redesigning spaces, or understanding an activity, an occupancy survey is really handy. Again, the visualization of data means that we can capture a lot of information in a really clear and concise way. Shadow safaris or day in the life. This is a great tool to really understand what life is like during a typical day for a lot of different people in that context that you're investigating. When you're undertaking shadowing, it's important that you're thinking about who you might want to shadow or see in that, doing activities in that space. What do you want to see them doing? Where might some of those interesting interactions happen? And why? So what are some of the emotions and feelings that people are portraying that you need to understand? And you might capture that in a storyboard, which is illustrated on the right hand side there. Visual mapping, as I said, really important tool to capture the data that you're gathering during your observation and interviews, and mapping that in a way that you can communicate to other people in your team, and then obviously to the users down the track when you're describing or presenting your solutions to test. On the left there is a symptom map, which is kind of mapping what symptoms people have and how they're feeling. And then on the right hand side there is an activity map, which shows where people are going, typically on a day in your life, perhaps looking at how that happens and where people go in the space. Interviews are obviously the most important data collection method, where you can really get those insights into people's motivations, their struggles, the things that they really help them, that make them happy, and then it influences their well-being. So really important when you're starting your interviews with your users is to develop an interview guide where you're stepping through, starting with quite specific information to build a rapport with the interviewee, then going broader, so really interrogating some of their hopes and aspirations and maybe some of the pain points that they're experiencing. And then finally digging deeper into concrete examples, so getting a lot more in-depth information about the experience itself. And an exercise that might help you to really dig deeper when you're interviewing people is the 5 whys method. So not just scratching the surface with their answers, really interrogating down into why that's happening and why they're feeling that way. Another tool you can use is Photovoice. So this is a great tool for not only getting people to, or capturing data from people who are maybe a little bit shy about talking to you about it, but also it can help you when you're doing interviews to really uncover some of those emotions and motivations that people are feeling. So it's important to give people a set of instructions about what you want them to take photos of, and then use those photos as a way to engage them in an interview. And visually, you might use them yourself to capture your thoughts about what's happening in the patterns that you're seeing with these users. Once you've captured this information in your observations and interviews, it's important to then interpret those observations, because that's going to push you to define the actual problem. And also you want to, if a number of people in your team are going off to do different observations and interviews, it's a great way to come back and summarize some of that information. So framing it in a way that where you're thinking about activities, the environment itself, the interaction between people, the objects that are involved in those interactions, and then the users themselves, and writing the findings and the interpretations that you are seeing. And this is a great template that you can access from the Design Thinking Toolbox. It's important when you're empathising to not only think about the average users that you might be involved in this experience, but also, in order to be more inclusive, really thinking about some of the extreme users or some of the lead users that might be involved in this experience. So it's important when you're selecting people to observe and interview that you have a representation from 1/3 of either extreme of the continuum, and then 1/3 of the average users from the middle of the spectrum. So this might be pertaining to, say, age, where most people are teenagers, for example, that come into this space or this experience, and you may need to gather some data from different age groups. Similarly with culture, with people who have limited or very good use of technology, they might be users that are one-time experiences of that environment, and then people who often use that environment, or novices to healthcare or experts in healthcare. So important to do that homework before you start. Once you've collected that data, we use persona as a great way of summarising some of the key people that are involved in this problem. So you can create these fictional characters who really sum up the majority of people that you've talked to, rather than actually using the exact people, making them anonymous. So it's important to then give these personas a name, give them a backstory, think about the scenario where they would be involved in this healthcare experience, the emotions that they might feel, the motivation for doing that, or the motivation they have towards improving the situation, their behaviours within that experience, and also what's inhibiting in them from really their ultimate well-being when experiencing this healthcare environment. So in the CQ Fellows workshop, I used this persona checklist, which is from the Australian Healthcare and Hospitals Association Experience-Based Co-Design Toolkit, which is a great summary of the information that you need to think about. And in the HEAL Connecting Rehab Services Across West Moreton project that Evonne ran, She actually used persona as a way to engage staff in actually thinking more or empathising more with their patients and their users in order to gather greater insights into some of the problems that they might need to investigate. And apparently these were really successful in really tapping into the emotions of what people are feeling, gathering other stories that might come up when people really engage with these personas. Once you've developed those personas, it's important to really interrogate them a bit further, or you may use empathy mapping to develop the personas. It could be either way around. But in this mapping, empathy mapping, we really interrogate all the senses of what these people are hearing, what they're thinking and feeling while they're in this healthcare environment, the pains, perhaps the great things that are working. We're looking at what they see, what they say, and what they do. So this is really digging deep into really understanding how these people are experiencing things from their perspective. And journey mapping is another tool which is really useful to understand a user's experience for a product or a service or a space over a particular time frame. And this really can help in uncovering new pain points and maybe some roadblocks that are happening within the space or the experience that you need to, tap into. And this is a great template that you can download from the Design Thinking toolbox to help you capture that information. I thought it was useful to introduce you to a case study where we used a lot of empathy tools, and important to realise that not every project is the same, but also sometimes it's really good to spend a bit of time thinking about creative ways in which you might gather this data. In particular, I was the lead on the PICU partnership project, in which we were looking at improving the family-centred care environment for both families and staff. And that environment in a paediatric intensive care unit, very stressful environment, staff are particularly busy, and parents are quite stressed and don't have a lot of time because their focus is on their child at that point, to spend talking to us and to, give us the whole story about their experience. So we came up with 3 different strategies in order to capture really pertinent information about their experience. So one was interactive displays with both staff and families. The second was parent pack, which was given to parents to fill out during, when they had a free chance, free time to spare. And that was made up of a few different activities. And then the pop-up marketplace, which started as a workshop to involve staff and parents to have that ability to have a conversation. But due to COVID, we had to change that to an activity that brought people into the centre of the space, which was what we were seeing that was the focus of the project, and really test that space as a social space, and also as a central space where people would come and drop in whenever they had a chance, in an informal, kind of relaxed environment, and just have a bit of a break from the wards. So the interactive displays, we used Dot Survey. This was put in the staff room, and this was a really quick way of gathering data about what experiences were most important for parents and families. And it allowed us to really visually capture that the functional and the spatial problems that existed. Secondly, a survey that was placed on the balcony for the parents and families when they were a bit more relaxed. I wish I had surveys, so asking them their opinions about what could be improved, quite a positive spin on things. And from that, we gathered that, again, the social spaces were coming up to be quite important in this space where parents and staff could interact. In the parent pack, we used visual surveys again, very quick to fill out, and we were asking parents to give us information on how they felt the communication around the PICU worked and how they felt about different experiences when they were in the space. In the marketplace, we used an activity called affirmation puzzles, where we had a series of questions asking parents and families to find a question that really resonated with them, which then was related to a different colour. They put up their ideas and we eventually were able to produce a very visual map of what was going on in that space and what really share some of those ideas with both other parents and staff. And in the data visualization there, you can see that the space to meet other parents is really important. You know, shared social parent spaces were coming up as being really important. Awareness chains was another similar activity where we asked parents to, you know, comment using some of the comments that resonated with them. And again, looking at the visualization, those social spaces, in particular a hub to connect with staff, were coming up as being really important. We also use Photovoice in two different ways. One in the parent pack where we ask parents to take photos of a number of different things and return them in the parent pack to us. And in the pop-up marketplace, we use photo journaling. So we took the photos, we hung them up on the wall and we invited people to comment on them, find a photo that resonated with them. It was a really great discussion portal, allowing us to have a really casual but really informative conversation with the parents and families, where they could really see that we were empathising with their needs and capturing some of their ideas so that they were involved in the process. So there are a few different tools that you might use in the empathise phase. Just in reflection, I wanted to get you to have a look at this quote by Henry Ford. If I had asked people what they wanted, they would have said faster horses. So this really says to us that it's so important for you to really think about the questions that you're asking people in the empathise phase and the information that you're gathering. In healthcare, I think there are a lot, and in other industries, there's a lot of problems which are often given quite a shallow treatment. So really important for you to think about the strategy that you're going to use in your empathise phase. And I'd like you to think about a problem in healthcare that you might have been involved in which a solution was reached before the problem was fully understood, and what was the outcome from that. Secondly, I'd like you to think of a problem in another industry or another area of, you know, it might be retail or hotels or another service provider that is similar to the one that you face in healthcare, and how they address that problem. Because oftentimes it's really good to look outside your industry and learn some of the effective approaches that have been used in other industries and how you can use that to bring that into your healthcare environment. I'd also like you to consider what empathy means in your healthcare environment. So, or with the problems that you're facing in your healthcare environment. So what methods might you use for your context to empathise with patients, staff, peers, other users? And how might they be different to other healthcare environments? So really thinking creatively about those methods. And also how you might question your preconceptions. How might you crush your assumptions and your biases and start to embrace that beginner's mindset? Because that is really the key mindset that you will need to embrace during design thinking. I also invite you to look at the resources in the presenters' resources and readings document that we're providing as part of this training module, and some of the readings that you might access to gain a deeper understanding about empathy. So I hope this has given you some insight into some of the tools that you might use. I will be doing the next module, which is define and ideate, which I think is probably the most creative part of the design process and potentially one of the most enjoyable. So I'll see you then.